Hi, I'm Justin Riley. Today on Wisconsin Doctors, diabetic foot ulcers are some of the most common types of chronic wounds that are found. We're on location at the Wound and Edema Center, part of Fort Healthcare here in Johnson Creek, to learn about how the care for diabetic foot ulcers and podiatry go hand in hand. My guests will include Dr. Brent Yagi, Doctor of Podiatric Medicine, and Brian Connery, registered nurse. It's all coming up right here on Wisconsin Doctors. Stick around. Hi, welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Wound and Edema Center here in Johnson Creek. And today we're going to be learning a little bit about diabetic foot ulcers and other chronic wounds and how podiatry kind of fits into the whole idea of chronic wound care. And with me now is Dr. Brent Yagi, who is a doctor of podiatric medicine. Dr. Yagi, welcome.
Thank you.
Good to have you with us. First time on Wisconsin Doctors.
It is.
Yeah. So talk to us a little bit about what is a diabetic foot ulcer and what's special or unique about them?
Well, as it states, a diabetic foot ulcer is an ulcer that occurs in diabetics, typically on the bottom or the plantar aspect of the foot.
Okay. The plantar aspect of the foot, where is that specifically?
The sole or the bottom of the foot.
Okay, so that's the plantar aspect.
Correct.
And what causes diabetic foot ulcers to occur?
Well, there's a number of different things that cause the occurrence of it. Typically with diabetics, there's four main factors. The first one is control of their blood sugar.
Okay.
The second one is pressure. The third one is infection.
Okay.
And the fourth one is nutrition.
Okay.
Those four factors kind of all together contribute to the development of ulcers on the bottom of the feet.
So this is something that can just form as a result of those four elements that you just mentioned. It's not something that's like a wound that becomes infected over time. It's like, you scrape your foot or something like that. This is something that can just happen, not as a result of an injury necessarily.
Right. Typically with diabetics, they're already going to have issues with what we refer to as neuropathy,
okay,
which is can both be autonomic neuropathy and sensory neuropathy,
okay,
which means they lose the feeling on the bottom of their feet. Also with autonomic neuropathy, they're going to lose the nourishment of the skin. Mm-hmm. So not only is their skin not as healthy as it should be, but it's more apt to break down because the patient that's not diabetic would normally have pain when there's pressure over that area or a breakdown in the tissue, and a diabetic doesn't feel that. Right.
So is losing sensation in parts of your body, is that a symptom of neuropathy, or is that essentially what neuropathy is?
Well, that's a symptom of it. Typically what happens is the nerve endings, just like the nerve endings in your eyes and in your feet, are very sensitive to fluctuation of blood sugar levels. And those are the first tissues that kind of break down or start to kind of go haywire and don't function like they should.
Sure, sure. So if somebody's experiencing some sort of, either a diabetic foot ulcer or some sort of open wound that's not healing, when is it time to go in and receive some sort of specialty care for that?
Really, immediately. Yeah. As soon as they notice they're having a problem, they should seek medical attention to try and get treatment right away, and also to prevent infection or further complications, which ultimately with diabetics can end up being an amputation.
Yeah, and that's something that is very preventable. It sounds like to me. I mean, if you can get in to see that specialist and get the correct care, you can avoid a potential amputation.
Correct. I mean, the treatment plan is obviously to prevent limb salvage is what we're trying to do. Right. And that's by basically controlling the infection, getting better circulation to the area, vascular consult, topical wound care, and the biggest, most important thing is keeping pressure off the area.
Okay, keeping pressure off, that's important. So talk to us a little bit more. I mean, are there other reasons why other than risking losing the limb, why it would be important to receive specialty care as soon as possible for a diabetic foot ulcer?
Well,
are there other health concerns?
Right, absolutely. I mean, as we mentioned, it can ultimately lead to loss of limb and amputation, and studies show that about 50% of the people that do lose a limb live less than 5 years after that. So
really,
it definitely has a effect on their overall health.
Yeah, I would say so. And what can a podiatrist do to help a patient maintain great quality foot care?
Well, number one is just explaining to the patient that they need to inspect their feet every day.
Sure.
Check for any openings, any potential chance of getting an open sore, or an infection, or any issues like that. Also, we deal with their shoe gear, how it fits properly to keep pressure off that area and to keep their feet well maintained.
Absolutely. And if a person has diabetes, I mean, really, that should be part of the care, is their doctor or whoever is working with them from a healthcare standpoint is reminding them, hey, you are probably experiencing some neuropathy in your feet, so be sure that you're checking those areas on a regular basis and make sure that there's nothing developing.
Correct. I mean, that's part of the routine care that they get on each visit. We're going to inspect their feet. They're going to check for their sensation. We're going to check to make sure there's no open sores or any other problems that they would be having.
I'm curious to know, we just have a little bit of time left, but I'm curious to know what brought you to the field of podiatry?
I was interested in some field of medicine and just realized there was a lot of people with foot and ankle problems. We see a wide variety of foot and ankle problems, from just routine general care to major reconstructive surgery, and really anywhere in between. And there's a lot of people out there that have foot and ankle problems, so we see a wide variety of issues.
Okay. Cool. This is something that kind of sparked your interest.
Yep. Right.
Cool. Very cool. Well, Dr. Brent Yagi, we got to take a short break here, but when we come back, we'll be talking a little bit more about diabetic foot ulcers and how podiatry ties in to the overarching umbrella of wound and edema care. So we'll be right back with more Wisconsin Doctors right here at Fort Healthcare. Hey folks, welcome back to Wisconsin Doctors. We are on location at the Fort Healthcare Wound and Edema Center here in Johnson Creek. And we've been talking about diabetic foot ulcers, how to prevent them, and now we're going to talk a little bit about how to care for them and how podiatry really plays a significant role in caring for diabetic foot ulcers. And I'm joined now by Brian Connery, registered nurse. Hi Brian, how are you?
Good.
And we're continuing to talk with Dr. Brent Yagi, who's a doctor of podiatric medicine. But Brian, I want to start with you. We got a demonstration earlier about it's total contact casting. What is that about? Talk to us about that.
Well, total contact casting is basically, it's a casting system used to offload a wound to help heal a wound. It also has the benefit of allowing the wound to not get the shear action with walking. It locks the ankle.
What does that mean, shear action? Can you clarify that?
Every time you take a step, you're putting pressure on to propel yourself forward. Basically, basic physics says is you're pushing against it,
right,
and you're causing some shear to the wound.
Okay.
And what contact casting does is it uses the cast system. I actually got a cast here. So
yeah, show us. This is cool.
The white part is the cast here.
Okay.
The idea is to lock this around the muscle of your calf.
Okay.
And when you then you put the system into the boot here.
Okay.
And you are actually using the cast material and the boot to transfer the force to the muscle, so you're reducing the pressure on the footbed.
Okay, so that actually transfers the pressure literally to the muscle rather than to, let's say, the bottom of the foot where the wound is actually trying to heal.
Yes.
Okay, that's cool. I never knew that. So how does this differ from an orthopedic cast? Say that you broke your ankle or something like that. How does this differ?
The primary purpose of an ortho cast would be to it's serving as you're trying to mend the bone, so
right.
you're protecting the bone so it can mend. Where what we're trying to do with the contact cast, we're actually trying to heal the tissues of the foot, not the bone. So it's if you're familiar with a traditional cast, it's 3 layers of plaster
Sure,
and
yeah.
fiberglass.
Yeah.
Where this goes on more like a sock, and
Okay.
it's a pretty slick system, actually.
Yeah, we got a demonstration earlier today. That was really neat looking.
These are typically changed once weekly also, so
Okay.
application, taking them on and off is a lot easier to do if you're
Sure.
doing it on a weekly basis versus a traditional fiberglass cast.
Sure, something that stays on for 6 weeks
Right,
or more.
correct.
Yeah, because one of the main reasons is you do have a wound that's open and it can get infected. You have to be able to see that at least once a week here.
Is part of the benefit of using this to protect from infection, because there's obviously pathogens and so forth in the open air, does that help, having the cast?
It serves as protection.
Okay.
Usually we use wound dressings that have some type of antibacterial effect, and that has more of an effect on
Sure.
infection of a wound, or if
Sure.
you're on, because you are in a environment that is a moist environment.
Sure, yeah, absolutely.
But we do our best to manage that and keep it in a good environment to heal a wound.
Yeah, okay, good. And Dr. Yagi, I want to turn over to you for just a second here because, this I've heard about this concept of skin substitutes. Talk to us a little bit about what that is.
Well, skin substitutes are a special membranous type of tissue that is applied over the wound to basically allow it to heal.
Okay.
Basically, it's a form of a skin graft, but it's truly not a skin graft.
Right. It's not permanent, in other words.
Well, it's made of different types of special tissues in the membranous makeup. The 3 most common ones we use here at the wound clinic are made of either neonatal foreskin, placental tissue, or amniotic tissue.
Wow, okay.
And so those cells of those tissue are implanted into this membranous tissue that's applied to the wound.
Oh, wow, okay.
And basically what it does is it decreases inflammation, it acts as a barrier to infection, and promotes new cellular formation within the wound itself.
Wow, when I was thinking skin substitute, I was thinking it was some sort of artificial wrap or something that was placed on the skin until the actual skin can take over and heal. But sounds like there's an organic component to this.
Correct, right. It actually can incorporate into the wound itself, and it doesn't need. Initially, when they were developed for in the operating room to be applied surgically to the patient. These skin substitutes that we're using now can be applied here in the clinical setting. They don't need sutures. They can be just applied with Steri-Strips. And then typically a non-adherent dressing layer goes over the top of that, and then an absorbent dressing over the top of that. And that's changed typically on a weekly basis.
Wow. Really quick before we go here, we just got to take a short break in a second here, but how do these help wounds heal? How do these help wounds heal?
Well, as I mentioned, it's a barrier to infection. Yeah. It promotes new cells to actually form within the wound, so the wound will actually allow itself to heal and start to generate those tissues.
And the benefits of casting, we've learned about a lot of different techniques here, including hyperbarics and in terms of healing chronic wounds and whatnot. What are the benefits of utilizing this? When would somebody want to utilize casting?
Well, casting we're going to want to use really as soon as possible, as soon as we notice that pressure is the biggest issue that we're dealing with. If we've eliminated infection, we've adequately addressed circulation to the tissue, and also the nutrition of the patient, that's taken care of. Then the next biggest thing is pressure, and so that's going to be the best way to offload pressure, especially on the bottom of the foot.
We're going to take a short break here, and when we come back, we'll talk a little bit more about diabetic foot ulcers and how they help to heal them here at the Wound and Edema Center at Fort Healthcare. We'll be right back. And welcome back to Wisconsin Doctors. We are on location at the Fort Healthcare Wound and Edema Center. And we've been talking a lot about foot ulcers and podiatry, and we learned a little bit about skin substitutes in our last segment. I'm excited to keep talking about this. We're joined by Dr. Brent Yagi and Brian Connery. Thanks again for joining us today. Dr. Yagi, we talked about skin substitutes. When are skin substitutes used best within the wound healing process? When is it time to make that step?
Sure. Well, typically we're going to try a number of different types of topical wound products on the wounds. And usually when you get to about the 30-day period is the time when we'll reevaluate the wound. And if we have documented that the wound has not responded to the care that we've given it to that point, then skin substitutes certainly will be considered at that point. And typically we'll want to see at least a 50% improvement in the decrease of the size of the wound within 30 days with the initial treatment.
Okay. So you're trying to get to that, you said 50% or 60%?
50%.
50% reduction in the
Correct.
size in a 30-day time frame before you go to considering skin substitutes.
Correct. It also depends on the size of the wound itself, too.
Sure.
There's certain parameters that have to be followed as far as insurance coverage and things like that for skin substitutes. They are expensive products.
Sure, yeah. And what are the patient's responsibilities for maintaining advanced wound healing care properly?
Well, really, there's not the responsibility on a patient is basically just to follow the instructions that we give them as
Right.
far as being a good patient, so to speak.
So do as these folks tell you. If you come in here, do as you're told.
Right.
Anyway.
Compliance is obviously
Sure.
a big issue
Right.
on their point, and we're gonna stress that with them, just
Sure.
like with the total contact casting. Keeping the patients off their feet and keeping pressure off the area is really important. But as far as the reimbursement or the insurance coverage and things like that, that's all going to be done by the staff here at the wound clinic for the patient. So they're not going to really have any obligation to do that for themselves.
So they don't have to make the phone calls to the insurance company and whatnot. That's done by the folks
Correct.
here.
That'll all be done by the staff here.
That's
Correct.
awesome. Just kind of jumping back real quick about when people have been seeing you, whether it's whether they're using skin replacements and so forth, or whether it's total contact casting. How much work is it for them to take care of themselves afterwards? I mean, you talked about staying off their feet. I mean, that's tricky for a lot of people, I can imagine. But I mean, is there a lot of things that they need to be doing in terms of just maintaining either the cast or anything else? Is it just basically stay off your feet and take it easy?
Well, right. It's we always consider it as a team effort.
Of course.
The patient's part of that. We're obviously going to stress diabetic education to the patient, making sure that again they're inspecting their feet, they're taking care of their diet, they're managing their blood sugars appropriately. All of those things are going to be factors that are going to contribute to whether that wound is actually going to heal or not.
And we didn't really even talk about how that's such a major role is managing their diabetes. That's what really kind of caused the problem in the first place. So I imagine that would be a huge part of it. So you guys have diabetes education and everything here that's available to patients.
Yes.
And
Yeah, absolutely. I mean, we have consults for diabetes education, nutrition,
Yeah.
vascular, infectious disease.
Yeah.
So it's like I said, it's a team approach. We have all of those specialties involved with the total care of the diabetic patient.
Okay, so here's the big question that I'm sure everybody watching right now is wondering. Do patients need a referral in order to come to the Wound and Edema Center?
Yeah, that's a good question and one that's commonly asked. They do not need a referral. They can self-refer here to the wound clinic. Some of the patients we see here are patients that we see in our private clinic. I'm only here 1 day a week. I see patients in my other private clinics throughout the area. I'll refer those patients here. Patients will be referred here by their primary care providers, by the orthopedists in the area. But also we have a number of patients that just refer themselves here for care, and they do not need a referral as far as insurance coverage is concerned or those type of issues.
And as far as any other concerns about insurance or anything like that, the staff takes care of that end of things, makes phone calls for the folks, and so that they can have that peace of mind. It sounds like. Correct,
right? They're going to be able to inform them, what needs to be done as far as pre-authorization or any other referral process that would need to be done. They would inform them of that ahead of time.
Excellent. Brian, you're not off the hook just yet.
Oh, okay.
I got the chance to ask Dr. Yagi in the first segment, what brought him to Fort Atkinson and what brought him to doing podiatry. What brought you to this specialization? I mean, this is kind of your specialty. What brought you here?
Honestly, I switched careers a number of years ago,
Yeah.
and I was in construction, and I got out of that because I wasn't feeling like I was helping a lot of people, and I really wanted to explore something different. And my wife is actually a nurse also, so I kind of followed her into the career, and actually to one of my last clinicals for school was here at the wound center here, and so
Really? Okay.
I guess I never wanted to leave once that happened.
Yeah. There's such a feeling of really being taken care of here. Like there's a team of people who are on your side and they really want to care for you. So it's awesome. It's awesome. Dr. Brent Yagi and Brian Connery, thank you so much for joining us today. It's been a pleasure speaking with you. Mm-hmm. If you are suffering from what you think might be a diabetic foot ulcer or any sort of chronic wound, give these folks a call here at the Wound and Edema Center in part of Fort Healthcare, I should say, in Johnson Creek, or talk to your primary care physician and see if they'll refer you, even though you don't really need to. But check in with your primary care physician as always and try to stay in good health. That's all the time we have for Wisconsin Doctors. From all of us here at Channel 57, we're inviting you to live longer, live better.